MBC is designed to augment your clinical judgment. So if you start doing MBC with a client and for whatever reason you start realizing that this is creating more stress for them, or they're very resistant to the measures, it's not supposed to take away the clinical judgment you have. There's actually a client that I oversee in our child and adolescent outpatient clinic for whom doing the PHQ-9 and or the GAD-7 would be really aligned to his goals. But one of the things we're working on is he's very, very avoidant of any uncomfortable emotions. And that really prohibits him from being able to self-identify and manage those emotions. So actually, we've been doing measurement-based care almost as like an exposure, right? Like a gradual exposure for him. But also that clinician has been tracking customized measures on him that then they share at like a monthly interval. So she'll ask him to self-report self-harm, and also we're tracking attendance. And so when it was time for a treatment reauthorization at 6 months, she was like trying to reset goals. And he was like, I can't do 80% attendance. I can't do whatever the number of, self-care was. And she goes, but look at your graph, look at your data. Because she was using that self-reported data from the sessions, knowing clinically it was probably too much to be doing a lot of like discussion about that. But then when she showed it to him, it was like, wow, you actually can reset these goals and you've been doing so well. So that's just an example of like the clinician still, your knowledge and your skill set is still in the room and is still really valuable. And there's always going to be kind of individual customizations.